Hello, everyone. I'm Angela Davis from NPR News, and I want to thank you for listening today and joining us for a special North Star Journey live conversation done in partnership with Sahan Journal to talk about the growing problem of substance abuse and addiction among Hmong and Karen youth. We have a full panel of experts here and a group of concerned community members as well. And I also have a co-moderator for this discussion. This is Samantha Hanglong from Sahan Journal. Samantha is the audience growth manager at Sahan Journal. Hi, Samantha.
Hi.
So start us off by telling us, why did Sahan choose this topic?
Yeah, it's really community driven. So, as many of you know, Sahan Journal covers stories on immigrants and communities of color in Minnesota. And we're hearing from many Hmong and Karen families who are alarmed by the increase in substance abuse that they're seeing in their young people, and especially when it comes to opioids and, in particular, fentanyl addiction.
So tonight we're here to talk about why it's happening, and how fighting addiction can be such a unique and difficult challenge in immigrant communities, and what's already being done, the work that's being done toward collective healing. We like to be solutions-oriented and give people hope as well. So let's introduce our panelists. Here with us tonight, we have Se-Klo Wah. Se-Klo is a youth case manager for the Karen Organization of Minnesota, and thank you for being here, Se.
Thank you.
Hi, nice to meet you. We also have Francois Vang, a Hmong clinical social worker at Nystrom and Associates, who specializes in working with immigrant and refugee populations. Welcome, Francois.
My pleasure.
Hi. And then next to Francois, we have Dr. Ziwei Antaba, an assistant professor of emergency medicine at the University of Minnesota Medical School. And he has a really unique background in global health, which gave him the desire to understand how historical mistreatment and trauma impact communities. So glad you're here, Dr. Antaba.
Thanks for having me.
And on the end there, we have the founder of Daryeel Youth. That is Abdurrahman Mukhtar there. And Daryeel is pivotal in targeting substance abuse and addiction among East African youth in the Twin Cities. And I'm looking forward to hearing your stories, Abdurrahman.
Okay, thank you.
All right. First, we want to really start by getting a good understanding about the unique challenges faced by Karen and Hmong youth when it comes to substance abuse and addiction. And Se-Klo, I want to start with you. Addiction, when you hear about it, substance abuse, I instantly think of how entire families are affected. But as a youth case manager at the Karen Organization of Minnesota, what are you seeing and hearing from the young people, the teenagers, the kids?
Yeah, so some of the things that I see and heard from the youth is that kids are able to get drugs anywhere they want. It's like the drugs are available everywhere right now, and
Easy to get. They're able to get.
yeah, they're easy to get. They can either get it from their friends, sometimes even their family member, and it's on the street and for strangers. So and now I see more and more youth are using, especially the Korean people, and we see as young as 11 years old are using right now.
11?
Yes.
So middle school, maybe. That's like, what, fifth, sixth grade,
Yeah.
right?
Yeah.
Easy access. And for, you said even maybe they can get them from family members?
Yeah. So like one of the clients, he started using it because his older brothers use it, and I guess they somehow get along and help one another to get on the drugs together. Yeah.
Do you find there's an awareness of danger with it? Or is it just seen as like, it's cool and it's what a lot of people are doing?
Well, I'm sure they all know it's as something very deadly, it's dangerous, but I guess because who they surround themselves with, especially those who are younger, they look up to older folks and older friends, and when their friends encourage us or pressure them to do stuff like that, and they want to be cool, they don't want to be left out, they want to be fit into the group. So although they may know it's dangerous, they don't know that how this could affect them, and they use it, and not long afterwards you can see they're addicted to it.
And substance use affects all communities, everyone. But what's unique or what's different about this within Hmong families, within Karen families?
So within the Korean family, it's harder to help the Korean youth because from my culture, with the Korean tradition, people don't usually tend to talk about their feelings or the things they struggle with. So by the time when the parent came to us to help their kids, they already their kids already highly addicted to drugs. So this was like it's already hard. It's making us harder to help them, if that makes sense.
Do you think they recognize they're addicted, or do they think, like, I could stop this whenever I wanted to?
Oh, they're highly addicted because most of the when I work there, they do want to stop, but because of the withdrawal so
Right.
bad for them, they just tend to go back to the to drugs.
So, how do you go about approaching young people, building trust, rapport with Karen youth who may be hesitant, reluctant to get help?
Yeah, so some of the youth they're more quiet, they're more shy to open up to you. So when I talk to them, like I don't have any special skills, but I use what I have. I show them love. I show them patience. I tell them I'm here for you, not as a teacher, as a brother. I'm not here as your case manager. I'm here to help you. I'm the resource. And sometimes I don't talk to them about the problem. I talk about other things, random things, and that's how they open up to me slowly. Because one of the kids, I tried to talk to him, but he wouldn't open up to me at all. So I was like, "Do you play FIFA?" He was like, "He do play FIFA," and then we started playing FIFA together. And then I can see he's totally a different person than was a few minutes ago. And he started to talk to me more and more. Sometimes I invited him to play soccer or to go to the gym together, and sometimes offer them a free haircut. That's how I build a relationship with them. But they all different. They all have different personality, and it takes time to get to know them one by one.
To build trust, to
Yeah.
allow them to feel seen
Yeah,
and
and
heard.
I just don't give up on that. I know many times they will betray me. They will go back to the things that they told me they're not gonna do anymore. I know that, and it hurts. Sometimes it get discouraged, but I told them I'm not gonna give up on you. I'm here. I'm here for you.
And one more question. That sounds like a success story to me, but do you have other success stories? Are there some young people that you met them at one point and you saw them change and have success and breaking free from addiction?
Yes, yes, sure. I do actually have a couple friends that I know personally. I know them as they're my close friend. One of my friends, he was my childhood friend from Thailand refugee camp. Then when he came to America, he was led in Georgia, and I was in Ohio. But I haven't seen him like in few years, like 7 years or so. And when I met him again in another city in countryside, he's changed. He's different, and I noticed that he was addicted to. It was a fentanyl at the time. It was meth something. Yeah, so he told me that he was when his parents moved out of that city to another city, he doesn't have any access to get to the drugs anymore, and there was not a lot of Korean people there. It was only a few of us, and none of us do drugs. So he doesn't want to do drugs. He don't want to do drugs no more. So he really disciplined himself to stop using it or to try to find a way to back to drug. Although he was suffering a lot, and I didn't know anything about that. So for a very long time. Now that I met him again after I moved to Minnesota, he moved here before me. Now he's doing very well, and I'm so proud of him because he's been sober for 2 years now. And literally this morning, we went to gym together. He was my personal trainer.
Oh,
So
wow.
yeah, he did went through a lot, and I'm so proud of him that he made it. And yeah, I have other friends who also went through the same thing, but similar story, but different way of overcoming addiction. One of them is that because he cares about his family, although he was very highly addicted to the fentanyl, now he's sober for 1 year now. So what really made him stop for the last time? I know many times he lied to his family, he lied to people around him that he's not using no more. But there's one time when he literally passed out in front of everybody in the classroom. And then he passed out, he overdosed. And then when he was in the hospital, he looked to his left, he told his sister that, please don't tell mom. But then his mom was right next to him on the right side. And then, yeah, it shows that he cares a lot about his family, but at the same time, he was also struggle with this addiction. But then ever since that, his parents moved out to a different city, and he cut off the connection with his old friends, and he go to the doctor, get the medicine, see the therapist, and yeah, made new friends, and now he's doing fine. I went fishing with him not long ago, and yeah, he seems very happy. Yeah, he's recovering slowly.
They can get through it. Thank you, Seklon.
Yeah.
Thank you. Francois, turning to you, based on your experience, what cultural factors do you believe play a significant role in impacting the readiness of Karen and Hmong community members in seeking treatment for substance abuse?
Yeah, I would like to start off by saying, and I want to make this very crystal clear that, culture is not the factor to blame here. Before I'm going to dive into the cultural factors, that are, contributing to the impact, that our communities, are struggling with, we really have to understand, the historical trauma that the Hmong community, including, the current, community have gone through. And I don't need to dive into the specifics of, our trauma history and, the impact that, I'm seeing every day, through the lens of my clients or even in my own community. But it is very important, and I really want to emphasize, that strong importance of kind of, going back to the roots of the historical trauma that, people continue, to struggle through. It's been, more than a little bit over 40 years that the Hmong people, have been here, at least in Minnesota. I'm counting, 20 now-ish, for the current community. And it is a cycle that definitely, needs to be broken down. But it is just so hard, especially when people, are gonna be, dealing with, all kinds of different, struggles, which leads to the cultural, factors that you mentioned. So for me, really, from a mental health therapist, what I would like to dive into are, the primary, cultural factors that, the Hmong community, are experiencing. And the one that really stands out for me, are the cultural expectations, the roles that we put in, for our sons, our daughters, our brothers, our uncles. What does it mean to be a wife? What does it mean to be a husband? So when you take the time to really dive into the roles and expectations of the different families, that we work with, there's just so much more complexity, and it is just so hard to make sense of this because here in the US, we value independence. We value, change. And as you can imagine, it is not how we perceive, our presenting problems. In the Hmong culture, and I'm sure that in the current communities, from what I've been encountering, I'm very confident to say that, collectivism is the way, of life. Because this is how we survive, together, in cohesion. So that concept of, collectivism is just so important to understand because when you live in group, everyone is going to have to play, a significant, important role in the family. It's not mom or dad or the caregiver who holds the most important role. And, everyone, plays a significant role. And whenever people are going to, be faced with struggles and adversities and those kind of things, like I said, drugs and mental health is just one fraction of the whole entire picture, but it goes much deeper than that in my own experience. So making sure that we understand, the roles, the cultural identity and what that means, for the individual is so important. That really leads to, the Hmong community really continues to hold a patriarchal society where men's, tends to have, more of a voice, and so I know that can also lead to some conflicts, between those different roles and those different, gender identity and again, what it means, to be a son, a man, so understanding that structural, family, is very important. And what I was going to say about, like the collectivism piece is that in order to make sure that we keep people accountable, right? Our culture, I'm just going to name it, uses, shame as a tool to really ground people in their role, in their identity. And shame is like this burning sensation, that you have on your chest. And it is such a difficult, feeling, an emotion, that does not make sense. And I would say, like, I think for the Hmong community, we continue to lack, to be aware, of those strong, secondary emotions that, our individuals, communities, youth, are going through, Drug has been used as a tool to cope. The emotional pain that, our communities are going through, the struggles, that our families go through is so complex, as stated before. So a lot of people, turn to drugs to numb the pain. And as a result of this, of course, those symptoms that, Seiklo, mentioned about the addiction are going to be, the forefront, symptoms, the behaviors, the maladaptive behaviors that we continue to see, within our communities. I want to make it very clear that a lot of families, from the Karen and Hmong communities continues to, practice this collectivism, right? And again, we don't have more of a positive, connotation around this. And in my field, we just call it the enmeshed family. And I want to make it very clear that I really want to be able to remove, the negative connotation that it's creating, for most of us as professionals and the mainstream society. And again, because the Hmong families, the Karen families, the first wave, the first generations, who came to this country, prioritized, survival. All they could do is to make sure that they can navigate, through the system, adjust and adapt, right, to the mainstream's expectation, the laws, the policy. And we continue to struggle through this. So we stick together, right? I think it's very difficult, for Hmong families to navigate through, the system, because unfortunately we continue to live in a society, that's very broken. Let's just name it. And part of this is really because of the lack of understanding, again, the lack of awareness, because it really goes back, to, the main roots, the historical trauma that I mentioned on the above.
So, Francois, I want to come back to you. Samantha has more questions for you, but I am a big fan of research and data. So, Dr. Ataba, I want to talk to you about data. research the impact of racial disparities in substance abuse treatment. And so I want to know, what does data that you have spent time looking at reveal about the prevalence of substance abuse and addiction within Minnesota's community of colors, particularly among Karen and Hmong populations? What does the research show, the data show about how big of a problem it is, and what are you seeing?
So I've spent some time looking at these questions. I've looked for data that help shed light on the differences among demographic groups around substance use behavior. And I can tell you that the data I've found, which is pretty light, is that there aren't significant differences, certainly not enough to explain the disparities that we're seeing when it comes to the level of substance use amongst different demographic groups. I think that's nationwide, but I think that's also true in Minnesota. What the data do show is that the outcomes, the health outcomes and the social outcomes of substance use are much worse in certain demographic groups. There's public health data that's actually countrywide, and then particularly in Minnesota, that shows certain demographic groups have much worse outcomes, chances of death from substance use disorder, from opioids in particular.
Is that because of disparities just in the healthcare system and just many other?
I think there's quite there's a list of contributing factors, including social determinants of health. But just to give you an illustration, Minneapolis in particular, has some of the worst health disparities or outcomes when it comes to opiate overdose deaths, the worst in the country, actually. In Minnesota, it's also bad, but the data that's available shows, say, for Black Americans compared to Black Minneapolitans compared to white Minneapolitans, it's about 4-to-1 increase chance of overdose death. If you look at indigenous communities, that number is 30-to-1 in terms of disparities in death data. That only tells part of the story, because each death certificate is associated with untold stories of harm that led up to that person's overdose. So the social consequences, the family separation, the isolation, the infections, the hospital visits. So we have a bad problem. The question when it comes to more specific communities like Karen or Hmong in this case, or Somali community, East African community, we don't necessarily have the public health data that drill down to that level to say, and I think that's the nature of how death certificates are reported. But we have other sources of data, the stories that we hear from communities, the patient stories that we hear in the emergency room in my case. These are also sources of data that tell us that there's a big problem. So I don't want to go too far down a rabbit hole, but I also wanted to just dovetail on some of what my co-panelists had mentioned. Seiko, you're talking about your youth engagement. Youth across the country are experiencing the highest increase in overdose deaths compared to the rest of the population. So that's probably also true in individual demographic communities, but that's a countrywide problem. That speaks to the importance of prevention, early intervention for youth, because they're getting younger and younger. These pills are disguised as something that is not necessarily as deadly as it sounds. People are pushing rainbow fentanyl. It looks like Skittles or candy. They're pushing, something that's counterfeit Percocet, so it seems more benign, and these kids may not have the wherewithal to understand what it is that they're being offered. And when it comes to trauma, I think that's true in populations better than I, but it's also true across the board. When it comes to contributing factors, I think trauma in general is a really underappreciated factor when it comes to overdose death. That's true for generational trauma. I think we see that across different communities. That's true for adverse childhood events. People who live with that chronic traumatic stress will look to self-medicate and
To cope. right?
to cope. Yeah.
So when I'd love for you to elaborate more about racial disparities and how that shows up in access to treatment, access to care when you're looking at substance abuse. How does that disparity affect the overall health outcomes?
I mean, I mentioned the impact on individuals and families and communities. When it comes to access, I think engagement and trust is also a major factor because if someone has a lived experience where they've been mistreated or felt marginalized, been marginalized, they're not necessarily going to trust our conventional treatment modalities. They are probably more likely to trust, my co-panelists than myself as a doctor because I represent a system that hasn't necessarily been friendly, a broader healthcare system in the country, to people, especially with substance use disorder. And that speaks to stigma and trust, which I think are two huge contributing factors.
Thank you, Zive.
Yeah, and Abdi Rahman, you've worked on that trust with the community as the founder of Dariel Youth. You've done work fighting against drug addiction in the Twin Cities Somali community. Could you talk to us about how you made sure that you were doing what really matched the community's needs and how you made sure that your program was working the way that it should?
Thank you. Again, I want to thank you, Angela, and Samantha, Embry, Minnesota Public Radio News, and Sahan Journal. So just to go back, when I started this street reach or outreach work, specifically regarding substance use, fentanyl use, and addiction, I've done youth work over 20 years, and that's something that I had a passion, and I had that trust with families and young people. And I received an email specifically concerning East African youth overdosing Fridays and Saturdays 8 to 10 and ending up Hennepin County Medical Center and Fairview, Cedar Riverside. ER. Specifically, when I received that email, and we used to deal with homicide and gun violence and other issues at that time. So, because that's where my boys were born, that's where I was raising my kids. That's the same neighborhood that my kids grew up and the same young people that I worked with. So I wanted to make sure that I understand more about what was happening. And the best way you can do that is just meet young people where they are, and just to find out the reality on the ground. And a lot of times, because we always had young adults and adults who are dealing with substance use, but normally with alcohol and other things. And because of our culture, and a lot of times we stigmatize and we shame them. And so people, even though we see them, they're dealing with addiction, we just call them names, but we don't associate, and we don't try to find ways to do outreach and help. So when I started the Real Youth, I had one goal in mind, which was really making sure that these young people who are overdosing, and because it was synthetic drugs, this is something that new to us. No one knew exactly what it was. Before even the fentanyl, we had K2, the synthetic marijuana. That was also a synthetic drug that these young people were dealing with. So my goal was to, number one, help these young people who are overdosing, just in case they need someone to call 911, someone to administer Narcan, someone who can also humanize them and have that human connection. But my other goal was also to educate and create awareness within our elders and community members, because mental health and substance use go together. There's a link. And because of our faith, it's a sin to even drink or do drugs. So when you are stigmatizing and you cannot even talk about this specific issue and topic, it's very challenging. And when young people overdose at home, We found out parents are even denying that because they really don't know what to say.
They want to keep it hidden.
Yeah, so
Right.
that's what led to, I've seen a lot of our youth and even some adults getting addicted to this lethal and epidemic of using opioid crisis, but we were not talking about this issue at all. And like I said, within our culture, we don't even talk about mental health. We don't have terminology to talk about even mental health, let alone substance use. So that's why I decided to be out there every Friday last 6 years. 8 to 10, you'll find me at the same location, and that is what led to the trust, building trust with young people who are using, and find out what resources, what help they need, but also educate other community members, parents, and then connect to resources to people that need the most, and allow professionals like Dr. Ziwe and other people that do this work to come and help, but at the same time connect that resource to the individuals that need the most.
Yeah.
I think the most important thing is that we see in our eyes, if you go to any city in Minneapolis, let's say if you go to Minneapolis right now, we see people who are struggling with addiction. These are our family members, these are our children, people that we know. But then let alone, we cannot even have eye contact with them. We don't even acknowledge because of, we see what they're going through pain, they're dealing with, this is a disease, but we don't acknowledge that. We just tend to ignore and think that they chose this. No one wants to be going through what they're going through.
Yeah. Were there any unexpected insights or lessons you've learned as you tailor your program towards the Somali community that you think as the Karen and Hmong communities are dealing with substance abuse and addiction that you think they could use to help them guide as they treat this as well?
Yeah, like we always say, navigating the health system, the education system, and the American system is really hard. When you have families, immigrants, refugees that are new to this country, and in our example, adults and parents who cannot even read and write their native language, but everything that, whether it's the education or the health system, is written in English language. Every information is written in English language. It's very hard to get the resource that you need, the awareness that you need. And these drugs are also new. We are struggling with this. Every city, every community in this country is dealing with this. But the difference with new immigrants is that we were not ready for this, and our parents are not aware of this. They don't know what these new drugs are, and we don't have the resources, we don't have the language to even talk about this. So a lot of times, because of the culture and how young people are raised in this country, what is also contributing to this is the use of social media. You can easily buy drugs now through your phone, and people will deliver that to you. In some cases, young people are at home, parents are thinking, my son, my daughter, she's safe, she's at home, she's not outside in the street. But then she'll say, I'll just go down quickly to grab something from my friend. They don't know drugs are being delivered to them. And then they will find their loved ones dying in the bathroom or their bedroom. So there's so many challenges that our parents and community members really need help with, and they are not aware of that. But the most important thing is really having an events like this, creating an awareness, and having a discussion, an open discussion about the link between mental health and substance use, and finding ways to have culturally appropriate outreach and awareness for every community.
Without shame.
Without shame and
Right.
stigma. Yes.
I want to take a minute and remind our listeners that if you're just joining us, you're listening to a special North Star Journey live discussion in partnership with Sahan Journal about how the Hmong and Karen communities in Minnesota are dealing with an uptick in substance abuse, particularly with their kids. And if you are here in person, we're going to ask you to text us your questions, and we will get to those in just a few moments. I want to reintroduce our panelists. We're talking with Se Klo Wah, a youth case manager for the Karen Organization of Minnesota, Francois Vang, a Hmong clinical social worker at Nystrom and Associates who specializes in working with immigrant and refugee populations, Dr. Ziwe Antaba, an assistant professor of emergency medicine at the University of Minnesota Medical School, and Abdurrahman Mukhtar, who leads Daryeel Youth, which seeks to help East African youth in Minnesota deal with substance abuse and addiction. A question for all four of you right now. You've done an excellent job sort of laying the groundwork, describing the problem, what's happening in homes, what's happening in the minds of young people. I need to know what's working. I want to hear about what resources, what techniques, what tools, what have you seen that seems to be making a difference, that is really helping someone who is struggling with substance abuse? Seklo, I'll go back to you. What's working?
So there's a lot of resources here in the local community. We do have a Korean organization, youth case manager like me, who we work really closely with the parent and help them get what they want, especially for their kids. And there's a police department that we work closely with. I don't know if I'm allowed to say his name, Sergio Toy. He's
Is he doing a good job? Go ahead and say the name.
Yeah. So he will go extra mile to help me with my client. Sometimes I was like, I don't really feel safe to go to this neighborhood to see my client. He will make time to go with me. He will talk to the client for me sometime. And there's a clinic that, provided medication. Sometimes we send the kids to churches to talk to the faith leader. If they're not Christian, we send it to the temple. They're in the Over Village. We also work very closely with them. And AYO, there's an Asia Youth Outreach. Right now they're hiring more mentor, which is something I'm really happy about, and because I believe every single one of my clients need a personal mentor.
Francois, what's working? What resources, techniques, tools, what is working to address this?
Yeah, so from a clinical standpoint, I'd say, I think not just within my own agency, but I think I've seen a drastic, positive change, in how, different agencies, tackle this issue and help our clients, them navigate through, their own struggles, especially, when it comes to, drugs and addictions and alcohol. I'd say, from a clinical standpoint, making sure that, our clinicians are well trained, right? Making sure that, we take the time, to, do a thorough, chemical health, comprehensive drug assessment, instead of just sort of like, jumping to, the professional recommendations, the fixing, I think we have to really slow it down and making sure that, we understand, the rationales, the motives, and those contributing factors, that kind of, led to this struggle. And then in terms of treatment, most of our clinical clinics throughout the metro do offer, SUD, groups where, the individual can come, and connect with other, patients. And then, rely on others, for, support and learning from the, group facilitator, the clinician, about, the tools, the life skills that they'll need, to really, overcome this challenge. So that direct service is there, it's out there. It's just a matter of kind of like, making sure that our communities is aware of, those places and how and the first steps, to connect. So.
Dr. Antapa, what's working? What do you find encouraging? What have you seen, have positive results?
I can't emphasize enough the importance of medication to treat this condition.
Medication.
Medication. Medication to treat opioid use disorder. There are different medications for different substance use, but by far and away, the most evidence-based intervention when it comes to reducing overdose deaths, when it comes to reducing the harms, all the broad societal harms that come from untreated opioid use disorder, are medications like buprenorphine or Suboxone, which is one of the most effective medications we have in the field of medicine. I say this because when people are on, if they have opioid use disorder and they're on this medication, their chances of dying are reduced by 70% compared to someone very similar who has opioid use disorder not on medication. It's that big of a difference. That being said, only 10 to 20% of people with opioid use disorder actually get this medication.
Because they don't have access to it, or why?
For a number of reasons, but access and I think trust and I think stigma, and there are barriers, I mean, all the way from federal government on down, there are unnecessary barriers to providing these medications to people who need them. They're starting to peel off, but not fast enough. The country of France had a bad heroin epidemic, skyrocketing overdoses in the 90s, and their main intervention was to introduce one medication, buprenorphine or Suboxone, onto their basically primary care clinics, onto their nationwide formulary. And they were able to reduce the number of overdose deaths by 80% in just 4 years, simply by giving this medication broad access. We live in more complicated times here in the US and we have a more fragmented system, but the biology is the same. I think if people understand that this is a biological disease, it's not a social or a moral failing or a spiritual failing. There's brain chemistry that is affected by this, that is damaged by this. Much like someone with diabetes, if they have a pancreas that doesn't make insulin, we give them that insulin hormone, that medication.
And it fixes it.
And it fixes it. They can lead a normal life. Well, fix for diabetics.
Right.
For people struggling with opioid use disorder, it's a combination. The medication is an important first step to stabilize, but then they need to unpack why is it that they started using in the first place, or all the trauma they've accumulated throughout their use. I mean, the life of addiction is a very traumatizing experience in itself, and I think that's why we're seeing this spiraling out of control.
Abdurrahman, share with us, what have you seen that works, a resource, a technique? What are some solutions you want people to know about?
Yeah, I think one thing that I've seen really working well is community members who dealt with addiction, who went to recovery, speaking,
Who share their story.
share their experience, and talking about recovery is possible. That really helps a lot. I'm also seeing a lot of faith organizations create awareness and without shaming, and have that discussion in a safe place. For the first time in my community that I see media and community members address mental health, but also discuss about the possibility of taking their loved ones to rehab without any stigma or shaming. The work that I do, being on the street and being there consistently and building trust relationship with young people, it's not only having a discussion about rehab, it's giving them a warm jacket in the middle of winter, giving them a pair of socks, just giving them something that they can eat that day. So when next time you want to talk about this, it's easy for you because you have that relationship with them. They know that you care. You made that human connection with them. And
Consistently.
yes.
Right. Samantha?
Yeah, so we've talked about solutions on a community level, but are there any key policies, like on the policy level or on the just initiatives that you could see that could effectively address the challenges that we've discussed today, and how can we make sure that those policies actually ensure the changes that we need?
So local or state or federal policies that could, that could be more impactful. Say, Claude?
So yeah, in the Korean community, I think the main one is that to educate the parent about this issue, this topic, because
Educating parents?
yeah, like about how to talk to their kids about this kind of problems, these drugs and stuff, and because a lot of the Korean parents they don't have relationship with their kids, and that's just how.
What do you mean? Or
So traditionally, Korean people they don't like they don't really show love to their kids, but they will buy things for their kids that tell them that they love them, But grow up in here in America in two different cultures is different. Like a
so
lot
the verbal exchange
Yeah.
may not be
yes.
what we're used to seeing.
Yeah, so like for now, we work with the Korean parents closely also to educate them about how to talk to their kids, have build relationship and about to prevent them from getting their kids from their kids not to get into drugs and stuff. Yeah.
Francois?
So in terms of policies, when I'm thinking about this question, I'm really going back to the client's ecosystem, the individual's ecosystem. I think making sure that we have policies that can, everything is just so interconnected, and I wouldn't want to blame the drug or the behavior for this major pandemic that our communities have been struggling with, but making sure that we can provide policies, right, that would give easier access to those vulnerable population, right, the Hmong, the Karen, and other subgroups, to live comfortable, in their homes, in their neighbor, providing more safety, more easy access to medical resources. For me, like I said, it's really the one thing that comes in mind. Developing policies that is going to provide a safe environment for the families, our youth, and our communities.
Dr. Antaba, local, state, federal policies that could change?
I think removing, to the extent wherever possible, removing barriers to accessing treatment, not only the medications, but the continuum of care when it comes to medication for stabilization, treatment for, basically starting the process of brain healing recovery, which is the long-term emphasis on well-being. Unfortunately, right now, our system of healthcare is not lined up to incentivize that, to support that. And the cracks are big enough that most people who have this condition, I would say 80, 90%, fall through the cracks. With something like fentanyl, with something like synthetic opioids, the clock is ticking because we've had fentanyl around for 5-6 years maybe, and the nature of this drug is so devastating for the brain that people will start with just a handful of pills and then go to injecting and then start using other substances like methamphetamine because that's the way their brain chemistry is damaged.
And is it correct, it's quickly addictive, like after one use, you can be addicted to fentanyl?
Yes. And single use can kill nowadays. One pill can kill nowadays is the refrain. So we're unfortunately living in the worst case scenario where we have, we started off 20, 30 years ago by pushing out pharmaceutical companies, pushing out opioids. And then 10, 15 years ago, there's policy changes meant to reverse that, but basically reduce the supply of pharmaceutical opioids, and then criminal cartels came in to fill in the gap. So even though the number of prescriptions are going down, the amount of overdose deaths are going up. So when it comes to policy prescriptions, I think as soon as possible, reducing barriers to evidence-based interventions, and those are treatment and what we call low barrier access or no wrong door to treatment. Things like emergency rooms in hospitals are, kind of a logical first step. If there are other areas that can absorb direct access, there are detox facilities and addiction clinics are increasingly, engaging people as soon as they hit the door. But all of that needs to be better incentivized, needs to be better supported. And on a whole, we'll actually save money if people are engaged in treatment rather than trying to finance their daily fix. This is an expensive habit. If they're filling their prescriptions, they're not going to be showing up in jail. They're not going to be, relying on social services. They're not going to be exposed to infectious diseases through using needles or exploitation. There's any number of nightmarish harms that come from untreated disease, and it's the most expensive way to handle this crisis, unfortunately. It's a lot cheaper, and this is shown over and over again, a lot cheaper to provide people treatment than it is to deal with the untreated consequences.
And Abdurrahman, if you look at local, state, or federal policies, what do you see as opportunities for a change that would be beneficial?
A change that will be really, really helpful is finding a policy that can hold accountable drug dealers, because comes down to money. People are making millions, billions out of this. So, and that's why you see the creativity of the synthetic drugs. Every few months, new kind of fentanyl drugs are coming up. So,
New ones, new in what way?
because they lace with new agents. They want people to be more addicted to these drugs. And that's why one bill can kill. So ways to deal with drug dealers who are, in every neighborhood selling this in the daylight, policies that can enforce that. But at the same time, policies that can encourage mobile clinics that can come to places where we know a lot of people who are dealing with this addiction can be found on the streets. Also, policies that can improve community conditions that can support grassroots efforts. Because we need creative ways to deal with this. The same way drug dealers are being creative, we also need policies that can be creative.
Thank you. Samantha?
Yeah. So we've gotten to the audience Q&A portion of our event. We've been collecting questions all throughout the evening and have selected as many as we could and to fit in the time that we have left. Starting off, we have some questions from a teacher to Karen and Hmong students, and as well as just in general advice for school mental health professionals. How do you help students who are becoming or have already become addicted?
So the question is, if you're a teacher,
Yeah, or
what
if you're
advice?
working in schools, what are the ways to maybe spot that a student is using drugs, or how to help
or
them?
find the words to have the conversation? 'Cause I think that would be hard. Maybe. Say, Chloe, I mean, as a youth
Yeah,
case
so-
manager,
yeah,
you know
also-
how to talk to young people, yes?
Yeah, so I also work with work at Humble with teachers. So some of the time the teacher will bring a student to me, tell me that this kid's might need help because he's looking skinnier. He's be skipping school. He's not he was the way he used to be. So
So teachers at Humboldt High School, you say,
Yeah.
are noticing changes.
yeah, they notice the change in. Yeah, and you can see when somebody's using it, they're not their self anymore. Their behavior changed. They tend to skip school a lot. Yeah.
So how do you talk to them? How do you
Talk to the student. So same way, like I will have one-on-one with them. A lot of time I will just go directly to the problem, tell them, ask them about like what's going on. Is there anything I can help you? And sometimes when they not open up, I just don't talk about the problem. Talk about other things to earn their trust little by little, and then later on, then we work on the problem.
We have limited time. Do you have another good question you want to share, Samantha?
Yeah. How do you all approach addicted individuals' underlying shame? We've talked about shame a lot tonight, but how do you deal with that in the conversations?
I would say, practice what you preach, and how I practice is through the lens of, embracing your own vulnerability, you know, struggling, not having the answers to all the questions. It's okay. And I think we really need to start, as professionals, as adults, we do have due diligence to make sure that, we stop labeling, we stop, pointing fingers. It starts with us, it starts with the community. So just to make sure that, we can create, that safe place, right? Flipping the script, right? Making sure that, we allow, our, individuals to express themselves and make sense of their own emotions, their thoughts, before, we get into those bad action, the addiction, the poor decision making. So, and again, when it comes to the Hmong community and the Korean community and others communities, we don't have the language, right, to understand the inner feelings, the choices that we make. So making sure that we pay close attention to that.
And Abdurrahman, you've talked tonight about shame, dealing with shame and finding the words.
Yeah. So a lot of times what I normally, when I'm on the streets, what I do, for example, the Vikings have been winning lately. And so I wear Vikings hat, and I know young people will talk about either the Vikings or the Timberwolves winning. That's how I start the conversation. Mm-hmm. Something that we have in common, something that reminds them their normal life, instead of talking about the addiction itself and what they're going through.
Right.
And because of that, then you normalize that conversation. And like we said, we are not all perfect. We are all human beings. We make mistakes. And this addiction and disease doesn't discriminate. But the sad thing is that young people people who are using are getting younger by the day. So if you are a teacher and if you work with young people, you should focus now vaping. That's the getaway. That's what leads to other drugs now. Vaping is number one because they add so many other marijuana, other drugs. But also reach out to people who dealt with addiction, who are now advocates, who talk about their stories, because storytelling makes a huge difference. So if you invite individuals that can share their own experiences, it goes a long way, and young people and parents can relate to that.
I would like to really stress on the importance of, partnership. I think, as either a parent or a teacher, it can be very difficult to navigate through that. So making sure that, you reach out, it is a skill, so that we can really engage in that 360-degree view and, find the right, professionals, the people, who will be able to help, the individual who is struggling.
Francois, along with that, we have a question here. What options are there, if any, for some immigrant communities who don't believe in Western medicine or talk therapy? Do you find that there are difficulties with navigating the approaches for traditional healing practices versus Western medicine?
Absolutely. I think the first step is to really validate, what they are experiencing. Change is really perceived as a threat. And again, from an acculturation, perspective, for some people it's going to work, right? For some people it's not going to work. And we have to be okay with that. I think, making sure that, we as professionals, can only do what we can, right? I always try to remind my clients that you can only be responsible, for the effort and not the outcome. And as part of the effort, from a clinical standpoint, making sure that we continue to provide psychoeducation, making sure that we can provide them with the tools and our recommendations. And recommendation doesn't mean that it is a requirement, but these are your options. And this is, what's going on, with your son, with your child, with your daughter, with them. What do you want to do about it? There's help, you know. And then also holding, you know, on the flip side, right, professionals and officials accountable too, to really, you know, to take the time to understand our culture, our language, our customs, and our traditions. I think this is really important. The Western's medicines, you know, our approaches is not just the only way, you know. So there are other interventions and other avenues. So it's not one fits all, you know.
And I'm curious, Dr. Antaba, how do you deal with that? Families or patients who really don't believe in Western medicine or question it. I know you've traveled the world.
Yeah, that's, you know, in brief, try and meet them where they're at, and try and flip the script, like you said. Try and better explain. You know, there are some medications that I think are essential, and the best I can do is offer a medical opinion and support their choices.
Our time is up for tonight, and I just want to acknowledge this has been a very enlightening conversation, very informative, and I want to thank our guests and acknowledge you again. We've been talking with Seklo Hua from the Karen Organization of Minnesota, Francois Vang, a social worker from Nystrom and Associates, Dr. Ziwei Antaba, an assistant professor of emergency medicine at the University of Minnesota Medical School, and Abdurrahman Mukhtar, founder of Daryeel Youth. A big thank you to the members of the audience here with us at the Great Hall in Washington Technology Magnet School here in St. Paul, as well as to the folks at both Sahan Journal and my colleagues at NPR News who work behind the scenes to make all of this happen tonight, to make this a community conversation. Thank you. And until next time, stay well, everyone.